So my name is Dr. Andrew Bradford. I'm a consultant in Rehabilitation Medicine, and today I'm going to talk to you about insomnia. I'll talk to you about what insomnia is, about some of the symptoms, the diagnosis and the treatment. So insomnia is a sleep disorder, and sleep disorders can be acute or chronic, and they sometimes can be due to shift work or night work or other changes in normal sleep pattern. Insomnia is diagnosed as a problem with sleep for more than 3 days a week for at least 3 months. There may be problems with falling asleep, with waking through the night. There may be associated symptoms including fatigue, mood changes or cognitive difficulties which can affect memory, concentration and decision making. In insomnia, patients have a more awake brain during the night when they're asleep. So this can lead to a reduction in the deeper stages of sleep, which are important for recovery and regeneration of the body. There's also a reduction in the sort of dreaming stages of sleep, which are important for memory consolidation and also for emotional regulation. Most patients with sleep difficulties attend their GP, and some are referred to sleep specialists. You should expect a sympathetic consultation based on biopsychosocial principles. You should provide a history. Some patients are recommended to take a sleep diary, which can be useful to see the pattern of sleep. There are some questionnaires that are useful for insomnia, and many patients are now wearing electronic devices and wearables which also record sleep patterns. There are some conditions that are important to consider and exclude as part of insomnia. This includes restless leg syndrome, where there are uncontrolled movements during the night. Problems or difficulty with breathing, such as sleep apnea or asthma, can also affect sleep. A number of rarer conditions, such as narcolepsy, where there's sudden onset sleep. And also some sort of abnormal movements during the night, but these are usually assessed by a sleep specialist, and sometimes this requires overnight monitoring either at home or in a specialist unit. The mainstay of treatment is early tailored education and self-management. It's important to look at lifestyle and to look at stimulant substances and drinks. These should be reduced during the daytime. There should be education about sleep hygiene, so it's important to have a comfortable bed with appropriate bedding that keeps you at the right temperature, that the bedroom is insulated from interfering sound and light, that electronic devices aren't interrupting sleep, and that you're not overdoing screen time, especially later in the evening. It's also important to get outside during the day and getting sunlight to help with melatonin production, which is important for initiating sleep. The mainstay of treatment is cognitive behavioural therapy, which has a focus on sleep, and this will help you to respond to the normal physiological cues of sleep, so that you act on those and go to bed at the appropriate time. There are also interventions such as sleep restriction, where you limit the amount of time spent in bed, which will increase sleep efficiency and help you stop making unhelpful associations between laying in bed for long periods and not actually sleeping. Also, meditation, breathing exercises and relaxation exercises can be helpful, especially if there's anxiety symptoms associated with it. There are some medications that are used for insomnia. The hypnotic Z drugs are used, such as zolpidem or zopiclone. These are useful, especially for restoring abnormal or altered sleep patterns and behaviours. They're a bit less addictive and have less side effects than the longer acting benzodiazepines, which are also used. Sedative medications such as antihistamines and mirtazapine are used. Melatonin can be prescribed in older patients, and more recently orexin blockers are used to reduce the physiological mechanisms that lead to wakefulness. Some patients also use prescribed medical cannabis to help with sleep. I hope you found this information helpful, and if you do have insomnia, then I wish you every success in finding the appropriate help and support, and feel free to get in touch. Thank you.